Hi, I'm Lauren Gates with Airway Health Solutions. Can you tell us a little bit about the next step for doctors interested in learning more about airway implementation?
Oh yeah, thank you very much, Lauren. So the idea behind that, 1 hour session was to kind of, get some interest in learning how to do it next. And so what we've done is we've created a 2-day program, and it's a mini residency where you would learn the techniques involved with treating patients in any age category, from the age of 3 all the way up to almost any number you could imagine.
Wow, and it's so timely. And maybe we can just dive in a little bit with the 2 days, because I know perhaps some dentists don't see children, so maybe they just want to take day two, which is an option. Or let's go through it comprehensively, starting with day one, which is the pediatrics. What should the doctors expect after taking our course?
Sure. So with a full day in the pediatric category, like you mentioned, divided so that a doctor interested in pedo or adult can focus on the day that's appropriate for them. In the full day of pediatrics, we learn everything from the beginning, which is the diagnostics. We'll need to learn what are the full diagnostics we would need in order to work our way into a beautiful consultation with the parents so they would have an understanding of what we're offering. And then, of course, through all of the treatment protocols. So we're talking about how most of the day is built on how to treat a child. And that can range from anywhere from nasal hygiene to removable guidance appliances to fixed expanders. All kinds of good things are involved with learning how to treat a child, not the least of which is going to be collaborative care, because it does take a village, and sometimes we need support from our community members, which I think you're going to mention in a moment.
Absolutely. So as far as I know, we saw a wonderful case earlier with the interceptive ortho using the myofunctional appliances, but we didn't have time to really show, or you didn't have time to show the fixed expanders. So tell us a little bit about that, the fixed expanders you use actually Ollendorf Appliance Labs, right?
Yes, yes. Ollendorf Appliance Laboratory fabricates all of my fixed expansion appliances for the children in the pediatric category. There is a large percentage of children that need fixed expansion appliances. And the probably one of the differentiating things about our program is that we teach a full lower fixed expander technique. In other words, you really need a set of expanders to treat a child well, an upper and a lower, in order to develop their arches appropriately. And so we're one of the few courses where a lower fixed expander is really taught in full so that you could fully develop a child with the intent of growing the jaws enough to accommodate the wisdom teeth. So even though we might be seeing a child at a young age, our goal is really to become an 18 or 20-year-old that erupts the wisdom teeth. And then we have a fully developed human being with 32 teeth and a beautiful chamber for the tongue to live in.
That's wonderful. So now let's go over to day two with the adults. So what should doctors expect after taking this full day?
Sure. Yeah. So, this is a special day because there's a lot of stuff available to adults that a lot of GPs aren't aware of. And so the idea there is, we definitely are looking again at growth and development, but we're dealing with mature bone. So the techniques vary a little bit. We're going to walk you through how to basically use removable expansion devices. And again, those are also made by Ollendorf Appliance Laboratory for us. Removable expansion appliances in an adult are very powerful. It's a terrific process with appropriate compliance. And again, that becomes part of the teaching how to use these appliances correctly. You can develop the maxilla and the mandible and then work on the teeth. So the adult technique is similar in that we work on the foundation first, and then we work on the teeth second. So the techniques that you're going to learn include removable expansion appliances, when are they necessary and how we would use them, followed by a clear aligner technique that is also in the expansive category.
And you also covered TMD and the benefits of expansion with your TMD patients as well.
Yes, and that's a significant component in that day because in our practice, we treat our TMD symptomatic patients with growth and development. And so the key to treating the TMD patient in the growth and development category is maxillary development. And so the idea behind maxillary development is that you have the opportunity to treat in almost any category of TMD symptom to full resolution. And so I'm going on now my 7th year of treating TMD patients with growth and development. And I no longer make night guards. I no longer make splints. We now treat them in the growth and development category. And it's a combination of removable expansion appliances and or clear aligners, but the technique has to be appropriate. So not just using those, how are you using them, and where is your pathway to an end result that delivers a patient that has no TMD symptoms when they're done?
Wonderful. And then after both days, we help the doctor with Airway Health Solutions with forms and protocols and articles and everything they need really to implement on Monday morning. So we hope that you check us out and learn more about that. I'm just going to go ahead and share my screen just so we can see upcoming events where if anyone is interested, we can go ahead and you can come to our website. It's airwayhealthsolutions.com/events. And here are the upcoming dates for the second half of 2021. We have certain Airway conversations that we host, which I'll get to in a moment. But one of our guests was Dr. Scott Siegel. And Dr. Scott Siegel is an oral surgeon, and he really stressed how there is such a demand. He sees it all the time for airway dentists. So we hope that you're interested because it's so much more than just drilling and filling. You're really helping save lives. And Dr. Miraglia, I know we're thrilled when we see this map because we started the mini residency 2 years ago. And since then, you can see all the doctors that we've trained and where we need more airway dentists for sure. But what a thrill to know that these doctors are now treating hundreds of patients with growth and development techniques that you have shared throughout your 18 years of experience. Another thing I want to mention is that at Airway Health Solutions, we offer a myofunctional therapy course that's geared towards the dental professional, either the hygienist or the dentist. And the difference about this course is we teach you how to implement this into the dental practice. So you have a greater access of care, your patients are comfortable, they get the support they need, and perhaps an added revenue stream. And we love our podcasts. We call them Airway Health Solutions Conversation Series or Airway Chats. And we've had some wonderful guests. I know Dr. Miraglia is a regular guest with all the information you share. So many pearls of knowledge. But we recently had Dr. Steve Karstensen, Dr. Gerald Simmons. We're having Dr. Michael Gelb join us in April, as well as Lauren Ballinger. So we're really excited. And Dr. Scott Siegel will return as well. So you can visit our website, airwayhealthsolutions.com, under the podcast for more information, as well as resources for you on social media. So check us out on social media, including a blog that we have on our website where I'm actually going through expansion myself in a very patient-friendly educational way. So it may be a tool if you need to educate, an example of what it's like to go through an expansion as an adult. You may recognize Dr. Michelle Lee, and she attended our mini residency as well as others where they're going to share with you their thoughts so you could hear it from our colleagues.
With our profession constantly evolving and changing, one of the key things that I've learned over the last years about is learning more about airway and the impact of airway and its effect on dentistry.
I feel very strongly that I get a strong return of my investment of time and money learning from AHS and Dr. Ben.
So what really built a lot of value for me in this course was understanding sort of the biology and the etiology of malocclusion, understanding craniofacial growth and development and how that can affect how we choose a better treatment and a better dental path for our patients.
Okay, so here's our contact information. Please feel free to reach out to Dr. Ben Miraglia and myself at info@airwayhealthsolutions.com. We have a wealth of information on our website. And also, if you're interested in getting in touch with Ohlendorf Appliance Lab, Kevin is wonderful. He's the president. You can contact him directly. So Dr. Miraglia, I know you have so much joy going to work and treating these patients. Maybe we can just close it out on just the benefit for the dentist to implement this type of treatment into their practice.
Yeah, there is such a long symptom list that comes downstream from the underdeveloped jaws in children through teens through adults that once you implement this in your practice, it doesn't take very long to get feedback. And the feedback from the patients is pretty powerful because it's not that you fixed a front tooth or you made a tooth straight. When you take in a few weeks' time a child that's been bedwetting regularly and it goes away, when you have headaches or nightmares go away, when you have TMD symptoms go away, and whether it's within weeks and or months, all of a sudden you have patients telling you a different kind of feedback in that you really made a difference in their lives because you changed something that was affecting their quality of life. And so once you and your team start to experience that, you just have to hear that about one child and you want to treat every child. You hear that about one teenager that was struggling with a symptom and you could take it away with growth and development. You want to treat every teenager. You treat one 40-year-old TMD patient that's had 2 decades of, palliative, sometimes symptom-related treatment, and it doesn't really do the whole job, and you fix that for them and it's gone. You have an opportunity. You want to treat every TMD patient, but I can't treat everybody in where I am in Westchester County, New York. So the idea is I'm able to have a bigger impact if I could teach other doctors to bring it to their communities. And then we have an opportunity to basically accelerate this opportunity to give growth and development to our patients across all ages so that other offices, the doctors and teams could experience the power of helping someone go from unhealthy to healthy.
Wonderful. Well, thank you for all you do, and thank you for sharing your wisdom with everyone. We hope you found this helpful, and we look forward to hearing from you at info@airwayhealthsolutions.com. Thank you. If you want to learn more directly from your peers, please visit us at www.airwayhealthsolutions.com/events.